what do you think the resistance is to talking about metabolic health? Is it because, and I struggle with this internally, so I'm just being very open with you here, is because the vaccine is like an easy, it's like, look, I've gotten it's like just all I got to do is roll up my sleeve. But metabolic health, like metabolic rehabilitation, is nutrition, it's stress management, it's movement. It's a lot of things that actually take a lot of effort. So I wonder, and maybe I'll let you weigh in on this, like what is the resistance to saying, hey, we actually have to have our population needs to up level its metabolic health. We need to get maybe the sunshine. Maybe I shouldn't have gotten a fact check thing on my Instagram. Maybe we do actually need to think about sunshine and vitamin D. Maybe we do need to think about movement, like whatever kind of movement makes you happy, even just walking after dinner. Can we all just like as a country commit to like walking 10 minutes after dinner? Something like that. What is the resistance? Okay, so that's my preamble. What's the resistance, do you think, to talking about metabolic health, or why did it seem to fall on deaf ears?
I honestly think it was a bit of unifocus. It was groupthink, it was unifocus, there's one way out of this. And Don't get me wrong, I'll say this, I don't think it's controversial. I actually think with the earlier versions of the virus, the vaccine worked on severe disease. I humbly believe that we saw people. I think when it came to severe disease, I actually think this was a game changer, and I think at some point people did not want to deviate from that message at all. That being said, imagine in that first wave before the vaccine came out, we said to folks, as you just said, yo, we're seeing a direct link related to metabolic health. Let's all get more active. Let's all think about how we're eating. Let's all try and manage our stress. Let's work as a community to just collectively get healthier. And not only is it going to improve your risk of COVID, but cancer, your longevity, essentially. What if that happened during that summer of 2020? And we have that muscle to try and be more healthy. Like that would be so beautiful. And people were ready, they were ready to do something. And I think it was a real lost opportunity. And then the other component of all this, I just think we did become unifocused. There was one, way out, but then we were also very black and white in our thinking in general. Like we were, you couldn't have two competing ideas at all. Like it was, why can't you could talk about being vaccinated at that time, but also talk about getting healthy. There's nothing wrong with that. There's nothing wrong with that. And especially when you think about interventions that are not going to be harmful. Taking vitamin D or getting outside is not going to be harmful. You know what I mean? Like swing the bat, act. You're putting some ability to have some control for people. Like the idea that we couldn't even, like, people weren't, whatever media, whatever, weren't gravitating to this at all. And there were medical studies to show metabolic disease being a risk factor. I still to this day I couldn't believe it. And like I had ties to the media, right? I would say, listen, can we cover this a little bit? Like even just a little bit?
Yeah.
And it was just going on deaf ears.
It's almost like whether it's the media or whatever, it's like there's almost this failure to believe that humans can hold two truths in their mind at the same time. Like the vaccine can help reduce severity. It can, all the things that it can do. And you also have to work on your health. And that's a much longer play, right? So the vaccine is a very short, you go to the clinic, it's done. And the metabolic piece is a multi-year plan.